Welcome back to the F.I.N.E podcast. I'm Chris Cox, and this is your podcast for genuine discussions about mental health. Today's podcast is pretty important. It's a pretty important discussion because it's on a topic that I think still a lot of people don't really 100% understand. And it really needs to be reframed, and that's addiction. Today, as a guest from CMHA, from our partners at CMHA, I'm with Danny Sud, who is a registered nurse with the Concurrent Disorders Program, focusing on individuals primarily affected by opioid dependency. Welcome to the show.
Thank you for having me. Good morning.
So just to start off, we'll talk about I'd like to talk about some of CMHA's services that focus specifically towards addiction. And I think as CMHA is, on the surface, it's known as a mental health agency. So we're going to unpack a little bit as to why we're talking about addiction and mental health. So first off, tell me a little bit about what you do at CMHA and with the addiction services.
Yeah, so thank you. As a registered nurse with the Canadian Mental Health Association, Halton Region branch, I support individuals across Halton Region, so Oakville, Burlington, Milton, Georgetown, and Acton, that are struggling with both an addiction-related issue, specifically to opioids, as well as a co-occurring mental health issue. When we talk about addictions and mental health, together that's called a concurrent disorders. So with the work that I do, I support individuals where they're at with whatever their goals may be. Some individuals may not necessarily recognize that they have a problem or they have an addiction or substance use disorder. So with those individuals, we really work towards recognizing, what their life is like. What are some potential opportunities for change? What does change look like? So we really are in the investigative sort of pre-contemplation phase. Other individuals come in and they know they're struggling right away. They express an interest in going through withdrawal management or detox, which is something that we provide individuals with support around. They're interested in getting some relapse prevention tools and skills under their belt, which is something we could support individuals with as well as ongoing maintenance therapy. And we do have access to some physicians that we work closely with that are very competent when it comes to addictions and mental health issues, that are able to put individuals on a plan to maintain long-term success. Other individuals may be having difficulties with the criminal justice system because of issues related to their addictions. They may have compromised finances, compromised housing. So we really support individuals, again, with whatever their goal may be. This always is very client-driven or patient-driven as opposed to clinician-driven. And we find that often is most successful when supporting folks with concurrent disorders, allowing them to, drive the bus versus the clinician coming in as, sort of the expert, right, and telling them what they need to do and not need to do. And by allowing individuals to really guide their treatment, we find that there's a lot of success with accomplishing their goals, as well as success with them in engaging and remaining in treatment, right, long-term versus sort of dropping off the map.
So I think, excuse me, I feel like everybody has sort of an image in their head about what treatment for an addiction might look like. So can you give like I know it's heavily dependent on the individual, but can you give like a general idea as to what that kind of support that CMHA would give, would look like? So if there are folks out there who might be struggling with an addiction, or it's a loved one who's struggling with an addiction, to sort of put their mind at ease as to what the help looks like.
Right. So when we talk about an addiction or substance use disorder, formally there are 11 different criteria that a physician or nurse practitioner would use to diagnose someone with an addiction or substance use disorder. Those 11 criteria could be best summarized in sort of 3 categories. The first one is continued use despite known negative consequences. So things may begin to start falling apart in your life. You may begin to experience the negative consequences associated with your addiction, yet you continue to use in spite of that. Another hallmark of an addiction is an intense urge and a lot of preoccupations with using the substance. So there's a lot of rituals that go around your use of substances. And when you're not using, those craving and urges are 10 out of 10. And the third criteria is the presence of withdrawal symptoms when you stop using altogether or you experience a change in the amount that you're using. So we assess individuals through a comprehensive biopsychosocial assessment to figure out where are they, right? Are they experiencing, all 11 of the symptoms? Are they experiencing 2 or 3? 4 or 5 or 6 or more. And depending on where they're at, they're experiencing either a mild substance use disorder, a moderate substance use disorder, or a severe substance use disorder. So someone with a mild substance use disorder or mild opiate use disorder, we work with them to figure out what supports they need to make change in their life. So some of those individuals may just need supportive counseling. Right? They may just need some coping skills, right? They may need, some information on cognitive behavior therapy, which is looking at how a certain situation impacts your thoughts and feelings and how that impacts your behavior, right? So do you find that you're using, whether it's an opioid or perhaps alcohol in response to certain thoughts and feelings? Right? And how can we mitigate around that? So again, someone with a mild substance use disorder, the interventions are primarily supportive counseling. Someone with a moderate substance use disorder, that's where we begin to provide a little bit more intensive supports. So, in addition to the supportive counseling and the relapse prevention or cognitive behavior therapy, we may be bringing on other stakeholders, right? So we may be working with their family doctor or a local RAM clinic to figure out, are there certain medications that may be helpful to manage the withdrawal symptoms and to manage the cravings and triggers? Right? These are individuals who, may still be working, may still have appropriate housing, may still have a source of income. So we really try to build upon those positive attributes in their life to get them back on track. Their goal may simply be moderation. So, I need to get back to a place where I could, consume alcohol or use my prescription medications in a manner that is safe and healthy. Or their goal may be abstinence altogether. Right? So whatever their goal may be, we support them with that. And someone with a severe substance use disorder, those are individuals where we really need to take off the gloves and come at them with everything that we've got. And those are the individuals that, we require intensive medical interventions in the beginning, right? Because in the beginning, counseling, case management, relapse prevention tools may not necessarily be appropriate because their addiction or their dependency has progressed so far that they need to use around the clock. So ensuring that we meet their medical needs first to get the physiological component of an addiction under control is of paramount importance. So in those cases, we would work closely, again, with their family physician or an addiction-specific clinic. Sometimes it may even involve going to an emergency room to get the withdrawal under control. Once we've managed to get the physiological basis of an addiction and including withdrawal under control, that's sort of in some cases the easy part. And then we're left with the minefield that is their life, right? So we're left with the situation where they're of no fixed address, they've got no income, they're estranged from their family, they may be, having open wounds on their body that need treatment. You're beginning to survey everything that has gone wrong as a result of their addiction, those negative consequences. And this is where the hard work begins, because you begin to, again, work with the individual and sort of triage what are the priorities, right? So what do we need to tackle first? And more often than not, that's housing, right? That's a form of income support, right? That might be access to healthy foods, and then we go from there, right? And again, housing in 2023 is so extraordinarily difficult, right? So it may take someone, a significant amount of time to find appropriate housing. The wait lists are through the roof. Rents are really high. So, that could take months, if not years, right? So we support, again, individuals, where they're at and, with what their needs and goals are. Some individuals on my caseload have been on my caseload for quite some time. And I think that's just a reflection, of how opioids impact individuals, right? This is not a population that you could really just treat within a few weeks, right? Or a few months.
Yeah.
These are individuals that you have to follow really long term. And in some cases, or actually a lot of cases, we partner with other community agencies or other organizations because, again, this individual needs wraparound care.
Yeah.
Right, to ensure that we've built a healthy, solid, community-based recovery framework.
Right.
Some individuals also request to go to a residential treatment program. So that's where they go away for, maybe 3 weeks, 30 days, 45 days. And in essence, they're in a structured residential program that gives them access to therapy. It gives them access to different classes on a variety of topics, right? Again, relapse prevention, healthy relationships, smoking cessation, fitness and nutrition, how to manage stress. And again, those those residential treatment programs are very helpful for some people, right? And other people, they don't necessarily want to go that route because it takes them out of their community.
Sure.
Right. And, in this day and age, with the wait list being so long, it's really unfortunate to have someone from Halton Region, say, travel to, Sudbury or North Bay, right? Because I think we need to give people treatment in the communities where they're at so they could be more successful.
Yeah.
Right. So, again, it's really client driven or patient driven.
Yeah. So then, it's a lot of support that's required. Yeah. So let's talk then about the differences, because like you mentioned, housing, we know where our economy is strained and incomes are strained. And so like pre-pandemic versus post-pandemic, like let's briefly talk about pre-pandemic compared to now. What have you seen, sort of boots on the ground, as to the differences?
Yeah. So actually interesting you bring that up because pre-pandemic, it would have been around the summer of 2019, probably around June 2019, where there was a lot of attention on addiction and mental health issues, right? It was, in the news a lot. People were talking about addictions, specifically to opioids, quite a bit. According to the recent data, specifically from the Ontario Institute of Clinical Evaluative Sciences, I know that's a mouthful, an average of 4 people die from a preventable overdose, specifically to opioids, per day in Ontario. So that was something that was at the forefront of a lot of policymakers, healthcare providers. That was at the forefront of our discussions. But one of the statistics that I heard came out of Statistics Canada. And again, this came out in the summer of 2019. And they said for the first time in decades, our country's life expectancy dropped. And they attributed that to the opioid epidemic that was ravishing, major metropolitan cities, so Toronto, Vancouver, etc. And I found that to just blow me away. I was just flabbergasted to think a country like Canada, our life expectancy has dropped because of an addiction-related issue. So it was something that was discussed. Then all of a sudden, a few months later, starting in, say, December 2019, we started hearing about COVID. So all the conversations around addictions, opioids, mental health disappeared. Right? Just completely disappeared. Understandably so. COVID became the new topic, right? And the new subject of discussion. In addition to that, a lot of the supports shut down. Right? A lot of the supports had to pivot to virtual-based supports, right? Or telephone-based supports. That in-person support that a lot of people were getting was no longer there. People were encouraged not to go to your emergency room unless it was absolutely necessary. So, those individuals struggling with an addiction or mental health issue that may, go to a weekly drop-in group or weekly counseling appointment or bi-weekly counseling appointment. They may go to hospital for care. They just stopped going. And they continued to get worse in their communities without having access to the healthcare that they needed. So the problem got immensely worse, but no one was paying attention, or very few individuals were paying attention. So those folks that you needed to remain in contact with just sort of disappeared. Plus, it became quite difficult for folks to get used to. Zoom. You want me to meet you through Zoom? I don't have a cell phone. I don't have a computer. I don't have a data plan. I don't know how to use technology. All of a sudden, you want me to use Zoom? Right? So, sorry, that's not going to work for me. Right? Or you want to have telephone appointments? I don't have a phone. I don't have a cell phone plan, right? I can't get to my local library to even use their computers because libraries had very restrictive limitations. So a lot of individuals dropped out of service. A lot of individuals suffered silently. And now here we are, 3+ years later, we're seeing individuals with addiction and mental health issues in a worse off place. They're sicker. They require a lot more intensive supports than perhaps the system can even offer. Right? And, the healthcare system right now, it's strained, it's bursting at the seams. So, the infrastructure that may have been considered pre-COVID, just simply never got built. Right? And, now wait lists as well are through the roof. One of the things that we do at CMHA is try to minimize the wait list through a variety of initiatives. But, some other organizations, specifically residential treatment programs, medical detox facilities, they're not as easy to get into anymore. Right? So a lot of folks are just throwing their hands up. Right? And, we try our best, but, folks are still struggling. And that's something that we need to, as a community, reconcile and do better.
Right. Yeah, I think it's interesting that you mentioned about everybody to go virtual. And I'm guilty of it. Nobody really, I don't think a lot of people really thought about, we'll just go virtual. Right, but do people have the resources to do that? Are they of the capacity to do that? Whether they have the technology or not. What if they're a senior and they just don't know, nor do they want to, right? It's a bit of a perfect storm, right? And I don't even think we're still seeing the full fallout of what had happened because I know I've got family who have mental health issues where the system was doing its best but still not really 100% adequate, and then COVID happened. And now there's that extra strain because now there's also additional people, and it's really tough. But moving on, we have to take a break, but that will lead us into our next topic around addiction, and that's or substance abuse disorder, which is the new term that's being used around reframing what that looks like. Because obviously you're here with CMHA, Canadian Mental Health Association. I think the vast population of our country, or just North America or the Western world, is still living under this very dated view of addiction. Is like, well, if you're addicted, that was your fault. You shouldn't have taken it, or just stop taking it, which is very dismissive. And I think we're at a point where yourself and the other professionals are saying and trying to get the message out, this is a symptom of something deeper. Substance abuse is a symptom of something deeper. So if we can treat the deeper thing, then maybe we can get to the substance abuse. So anyway, we'll take a break, and then when we come back, we'll talk about reframing what substance abuse disorder is.
Great.
We'll be right back.